The reality is that in the early and the moderate stages, it's not really easy to tell that someone has glaucoma. That's the part of glaucoma that we call like sneaky. We call it the sneak thief of sight because it's really very gradual. There are actually different types of glaucoma, but the most common form of glaucoma is typically something that's going to happen in a gradual way where you're not really noticing the damage that's being done because there will be maybe small blind spots that are present but kind of fused together when both eyes are open. And not until you get into the more advanced stages do you actually notice that you've actually had some vision loss. There are some types of glaucoma. There's categories of open angle glaucoma and narrow angle glaucoma. Now, narrow angle glaucoma is not as common in the United States. It's more common in Asian populations, but there are sometimes more symptoms with that, where you can actually get sudden eye pain, pressure loss, hazy vision, redness in the eye. And those are signs that would acutely tell you that you need to get your eyes examined right away. But again, by far, the more common glaucoma that's present in the United States, which is open angle glaucoma, is very asymptomatic in its early stages. Well, actually, there is a really great screening tool. It's not specific for glaucoma, but it's a very quick tool that one can do at home very easily. It's called the cover uncover test. And it's not uncommon for someone to have advanced glaucoma and come in and not realize it in the office until we actually cover one eye and have them look at a chart and read it, and then cover the other eye and have them look at the chart and read it. What you're doing with this cover uncover test is you're looking for some type of asymmetry or difference between the two eyes. So if it's important to kind of cover your hand in a way where you're cupping your hand, so you're not pressing on the eye, but you are covering it completely. And then you just, with the first eye, let's just say the right eye, you're going to just look out and see if everything looks pretty normal. Okay. And then you're going to do the same thing and cover the first initial eye. And now with the second eye, you're going to look to see if there's anything that looks different. Now, if you start to say, wow, I'm not seeing as well out of this eye as I am out of this eye, then that is a very big sign that you need to get your eyes examined. Again, it's not necessarily specific for glaucoma. It could be, but it could also be some other eye conditions that can potentially be treatable. And so you want to get your eyes checked. It's also important to know that when it comes to glaucoma, there are a number of different people who are at higher risk. And so the only way that you can be diagnosed with glaucoma is really by having someone look inside your eye and to be able to assess signs of glaucoma by changes in a structure in your eye called the optic nerve, and do certain types of diagnostic tests that are common for being able to diagnose glaucoma. Now, if you are someone who has a family history of glaucoma, you are at a higher risk for developing it. You have a blood relative. If you are elderly, as you age, you have more risk for developing glaucoma. So if you're in your 60s and above, you should start thinking about getting your eyes checked regularly, like annually. If you are of African descent or Hispanic descent, those populations tend to get open angle glaucoma more commonly, and they actually also tend to get glaucoma at earlier ages, and it tends to be more aggressive. And so it's really important for regular screening exams, meaning going to an eye doctor and being evaluated to see if there are signs of glaucoma. Right now, we don't have a cure. The good news is that we have really good treatment that helps to slow the process of glaucoma damage down quite significantly. The good news is also is that innovations are happening all the time for different treatment methods, whether with medications, light energy laser treatments, or with certain types of surgery. We have a whole class of what we call minimally invasive glaucoma surgery that is effective and has a high safety profile. And so the exciting thing is that there's a lot of innovations on the horizon, but in the meantime, we have treatments that help to lower the eye pressure, and you should get assessed by an eye care provider that you trust to be able to assess whether or not it's present, and also know that if it is present, you need to have chronic continued care Glaucoma doesn't go away. Even if you're treated adequately, you still need to be monitored because things can change, and you need to make sure that things are stable and protect your vision.